My name is Debbie. I'm 62 years old. I was diagnosed with hepatitis C approximately 30 years ago.
At the time, Debbie's doctor advised her to wait for better treatment options, such as those we have available today.
My doctor suggested, we have time, you could wait, there's things coming down the pike. And that's exactly what I did.
Today, more than 3 million Americans are infected with hepatitis C. Dr. Ira Jacobson, Director of Hepatology with NYU Langone Medical Center, explains more about this virus.
Hepatitis C is a virus that infects human livers. Once hepatitis C virus gets into a person's liver, only about a quarter of all people can get rid of it. So the majority of people with hepatitis C unfortunately develop chronic infection, and that's what we worry about with our patients.
Middle-aged people appear to be at higher risk. Those at higher risk are listed here.
Hepatitis C is transmitted by infected body fluids, above all blood. We've been able to identify, at least in the United States, the age group in which hepatitis C has the highest prevalence, and that is clearly the population born between 1945 and 1965, for which we have the conventional designation of baby boomers. About 2/3 of Americans with hepatitis C fall within that age group.
Now, patients should be screened for hepatitis C based on their age group and based on their history of risk factors. Those born between 1945 and 1965 should have at least a one-time test for hepatitis C.
Identifying patients who are walking around without knowing they have infection is the first step toward eradicating this disease from our society. Linking them to care is the second.
I never showed any symptoms at all. I was perfectly healthy, energy, everything normal.
Mary Olson is an adult nurse practitioner in hepatology with NYU Langone Health. Working together with Dr. Jacobson, she helps patients like Debbie understand that hepatitis C treatment is now easy to tolerate and highly effective.
People are often surprised to know they were at risk for the infection because you could have contracted the illness decades prior.
Debbie shares more about her past and whether she knew when she contracted the hepatitis C virus.
I never put my finger exactly on it, but most likely growing up in the era I did, partying, and I came out of the 70s. We partied a lot. There was drug experimentation, and that's the only thing I could say. I was not a hardcore drug user or anything like that, but I guess it only takes once.
It's very easy to get tested for hepatitis C. It's just a blood test that can be added to any routine testing you're having with your primary care doctor or other medical provider.
Routine testing for hepatitis C measures antibodies to hepatitis C in your blood. If antibodies are present, a second test can identify whether you have hepatitis C genetic content in your bloodstream. If this is not present, then the virus is no longer active. If the genetic material is present, a doctor would make a recommendation for treating the virus.
Sometimes hepatitis C, even though it itself doesn't have a lot of symptoms, can cause other health problems. And since it's so easy to cure, we really encourage people to get treated.
Dr. Jacobson adds how today's drugs are able to target this virus so effectively.
Our current revolutionary drugs cure almost all of our patients by targeting 2 out of 3 of the viral proteins that we've learned how to target. If you inhibit those with the drugs that we use, then the virus's overall replicative capacity is paralyzed and the virus just seems to decay away and dies eventually.
From both the nurse practitioner and patient's point of view, treatment appears to be well tolerated.
So in the past, hepatitis C treatment used to be very difficult to tolerate. It was injectable, there were major side effects and even some long-term effects. But now we have new regimens that are just 1 to 3 pills daily, and the treatment is shortened to 8 to 12 weeks, some cases 24 weeks, and the success rate is quite great. We are also having better success at getting treatments approved for patients.
The treatment was not difficult at all. The very worst I felt was maybe a little tired for 3 days, but not tired in the sense that I wasn't doing my usual routine. I felt great. I really didn't feel any different than I would normally feel.
When we test a patient's blood with this very powerful tool, PCR, to look for the virus's RNA or genetic material in the blood, if it's gone 12 weeks after the end of any of our current preferred courses of therapy, it never comes back, with very, very rare reported exceptions. Those patients are, for all practical purposes, cured.
One of the more rewarding things for a doctor is successful treatment. What's more, Dr. Jacobson reports that once the viral infection is cleared, the liver can actually heal and clear scar tissue.
I feel really good. Although there were no physical symptoms or problems earlier, as I got older, I always had a little something in the back of my head nagging me about developing liver cancer and dying a horrible death, and that feeling is gone. So it's a very wonderful, freeing feeling. I feel great. So physically and mentally, it's all good. Get tested, because the treatment is like taking a vitamin a day. You will never have to think about this disease again. You'll be free to live your life and enjoy it.
Today, Debbie is living an active lifestyle with her husband, enjoying daily hot yoga sessions, international travel, and visiting with friends. Thanks to diagnosis and effective treatment, she is 100% cured of hepatitis C. The Hepatitis C Support Project is a registered nonprofit organization founded in 1996 by Alan Franciscus and other HCV-positive individuals to address the lack of education, support, and services available at that time for the HCV population. Alan has been working in hepatitis C and HCSP since 1996 and considers HCV advocacy his highest priority. This health initiative has been brought to you by the Hepatitis C Support Project and a generous grant provided by Merck & Company. For more information, visit the website below.